Welcome to another edition of the Wound Care Window. I'm Dr. Jeffrey Niezgoda. We're here at AZH Wound Center in Milwaukee, Wisconsin. I'd like to demonstrate the application of another advanced technology that we're using here with great success. We have a patient here with a venous leg ulcer. He came in with some blistering a day ago, and that epidermal blister was debrided and exposed. The patient was put in compression, and he returns today with significant drainage. What I'd like to illustrate is that once you violate the epidermal layer, you expose the subdermal tissues to the outside environment. This is a portal of exit for the fluids that are found in the tissues. We've got actually a fairly good control of that edema. However, the patient is still draining significantly, so he's going to go back in compression. We do have a raw exposed surface here. I'd like to introduce you to a technology called Altrazeal. This is a transforming dressing. It's a polymer dressing that has nanoparticles, provides a very nice covering over the surface, and by doing so, we accomplish several things. Here is the Altrazeal, and it's in a blister pack, as you can see. We open the blister pack, and then we sprinkle the Altrazeal on the wound. When the polymer dressing comes in contact with the fluid on the wound, it transforms and polymerizes and forms a barrier. You can see the Altrazeal sort of coming out of the package, dripping onto the wound base. When you're applying this, you don't need to apply a lot, just a small amount, and you see what's happening is that is being incorporated into the wound surface. The nanoparticles are being hydrated and they then polymerize. What this dressing does for us is it essentially provides a barrier to the outside environment. When we have wounds without epidermal surfaces, those certainly allows a portal of entry for bacteria, and this polymer is so dense that it does not allow bacteria to penetrate from the outside world. So it does protect the surface of the wound and the underlying tissue from bacterial penetration. What it also does is it provides an ability for moisture to continue to come through the polymer and drain outward. That drainage can go into a secondary dressing or evaporate into the air. What we also have seen from this type of technology is that patients report significant decrease in pain. And why is that? Well, we know that when we do have epidermal loss of the epidermis, we do expose the underlying nerve endings, and by applying Altrazeal to the wound surface, those nerve endings are covered, and it seems to downregulate the pain sensation that these patients have. You'll see I'm applying the Altrazeal in a very light coat. You just need to provide a thin layer. It doesn't need to be caked on. This is certainly a technology where more of the product is not better. You need a light coat. Most of the time, the moisture on the surface of the wound will cause the polymer to hydrate. Sometimes additional moisture has to be added. When you do have a white layer on a frosting, if you will, across the wound, I like to add some additional moisture, and I'll demonstrate that to you. So one technique for hydrating is to take a small gauze. There's a number of different ways to hydrate. I like this technique. Take the gauze and you moisten it with some hypochlorous acid. And then we're going to take and we're just going to gently drip the hypochlorous acid. And you see as that fluid does engage the polymer, it does form that polymerization barrier that we talked about earlier. We'll slowly walk these drips of hypochlorous acid across the wound base. We'll let gravity take effect here in just a little bit. It'll pull it down. And we're not putting a lot of moisture in. You see how that Altrazeal is forming that barrier. The Altrazeal stays in very close contact with the surface of the wound and adheres to the surface of the wound. It does allow moisture to penetrate, as I mentioned earlier, due to the high vapor transfer rate, but again performs a very dense barrier against bacterial invasion to the tissues, likely enhancing our ability to decrease infection. And that's all we really need. What we're now going to do is come back with a secondary dressing. The secondary dressing can be picked based on the characteristics of the wound. Here, a foam would certainly be appropriate. And then we're going to place this patient in compression. Altrazeal will stay on the wound for up to 7 days. When we see the patient back, you do not have to debride it. You can just reapply it right over the top. I hope you enjoyed this edition of the Wound Care Window and this demonstration of a very interesting technology, the nanoparticle polymer dressing, the transforming dressing called Altrazeal.